of the Council of Deans of Nursing and Midwifery Australia and New Zealand, it's my great pleasure to celebrate this 2023 International Nurses Day with you all. My name is Marie Gertz and I am an executive member of the Council of Deans of Nursing and Midwifery Australia and New Zealand, and I'm also Professor and Head of Nursing at the University of Melbourne. Our organisation, the Council of Deans of Nursing and Midwifery Australia and New Zealand, is the peak body representing university schools of nursing and midwifery across those jurisdictions. I begin today by acknowledging the traditional owners of the different lands that we are all meeting on. For me, that's the Wurundjeri people of the Kulin Nation, and I pay my respect to all Australians' First People and honour more than 60,000 years of unbroken connection to country. I acknowledge elders past and present and emerging generations, and I extend that deep respect to all First Nations people across the world. The theme for International Nurses Day in 2023 is titled Our Nurses, Our Future. This campaign seeks to address the global impact of the COVID-19 pandemic on health workers and on nurses in particular. And today we're going to reflect on this theme by talking about the importance of building staff resilience to counterbalance some of the negative impacts of the pandemic as we look to a future where the health of nursing workforce is a basic priority and is recognised as a key mechanism for driving improved health outcomes for individuals and for communities. It's my great pleasure to introduce our speaker, Professor Kim Foster, who I will be interviewing today. Kim Foster is Professor and Eileen O'Connor Chair of Mental Health Research in the School of Nursing, Midwifery and Paramedicine at Australian Catholic University. Kim leads high-quality collaborative health services research with mental health nurses, consumers and carers and multidisciplinary colleagues. And her aim is to translate findings into effective care and improve the experiences and outcomes of mental health carers and consumers. Current key areas for her research are the wellbeing and resilience of the nursing and health workforce and the needs of children and families where family members have a mental illness. Welcome, Kim, to this webinar. And I want to start by talking to you about some basic definitions. So your work in workplace resilience is really about supporting nurses, but I want to ask you, first of all, what is workplace resilience anyway?
Yes, well, it's a good question because there's lots of different understandings of resilience. Previously, it was all about focusing on the person themselves, their traits, personality traits and characteristics. But really, we've moved on a long way from that. And the current understanding of resilience in the context of work is that it's an adaptive process and recovery of well-being following stress and adversity at work. And it involves not only our personal characteristics and skills and coping skills with stress, but also the environment around us. So who and what is around us in the workplace and in our life to support us when we're having difficult times following stress.
Okay. And then just picking up on that thing about the environmental characteristics, what are the characteristics or factors that research has found to be most important in that adapting process and the ability of nurses to recover from stressful workplace settings?
Well, look, the organisation and the environment at work is really critical and probably the most critical factor, because what our research and other research has found is that it's the relationships and the social support that staff get, and particularly the relationships between colleagues. So having supportive colleagues, having people to debrief with at work or after work, as well as having family and friends to be able to provide emotional support. The other factors, managerial support, so having managers who listen and respond when staff are having difficulty. Also having resources available if staff are experiencing distress, so being able to access counselling, getting work workplace wellbeing strategies provided by the workplace. Some organisations, for example, have peer wellbeing support where you can speak to a colleague who is outside your work area but provide you with emotional support if you need it. And that's happened during COVID in some organisations. And also providing professional development strategies like resilience programs and other forms of professional development that support nurses' ability to manage stress, to develop their stress and coping skills. They're some of the key factors that we've found. And so for a lot of nurses, it will depend on where they're working, the teams they're working in. So that's another big factor, the environment that they're working in, whether they feel a sense of belonging in that environment, whether they feel appreciated and valued by colleagues and staff and managers. So, yeah, so that the environment itself also is often responsible for a lot of the stress. So in the sense of high workloads, low staffing, high acuity, those sorts of factors are related to the organisation. So resilience is really about trying to reduce some of those stresses as well as strengthen people's coping skills. And so for a lot of nurses, it is about both of those things. It's having the support around them, but also developing their own capacity to manage stress.
Right. Well, Kim, I recently attended a fantastic presentation that you delivered only a couple of weeks ago, and it was about this project that you're leading called Promoting Resilience in Nurses program, or the PRIN program. Can you tell us a little bit more about that program?
Well, that program actually was developed by researchers at Queensland University of Technology, Professor Ian Shockett, and originally was developed as a workplace resilience program, which I had investigated, and I looked at resilience interventions because at Northwestern Mental Health, where I was working, there was a concern about how we could support nurses further in the context of workplace stress. And so I suggested maybe we look at resilience interventions. And resilience interventions are a prevention strategy. They upskill nurses so that when they are faced with stresses, with a conflict in the workplace, or with dealing with stresses in their organisation, that they have the skills to manage that for themselves. And so with the Promoting Resilience in Nurses program, it was called Promoting Adult Resilience initially, and then we tailored it in conjunction with the developers at QUT for the nursing workforce. And it's an evidence-based, strengths-based prevention program. And basically it is offered in a face-to-face peer group environment where you train senior staff, nurses, for example, in the workplace to deliver the program. And it's offered in that peer group environment. It has manuals, workbooks for staff, a lot of activities and different kinds of interactions in a workshop environment. So the way it's structured is there's 6 modules that address things like how to manage conflict, how to improve relationships, how to manage stress, how to support your mental health and well-being, how you might develop post-traumatic growth following critical incidents. And so the way we structured it was that nurses come out of their shifts for 2 workshop days, spread 3 weeks apart, so that they come in, they do a workshop day, they go away and they practice some of the skills, and then they come back for the second workshop day.
Okay, that's really interesting. You did mention that it was originally a program for all workers, but that had become tailored for nurses. Why did the nursing workforce need a tailored intervention?
Well, yeah, that's a good question too. We tailored it in conjunction with Ian Shockett and his team at QUT, because the activities and the exercises in the workshops needed to be tailored for nursing speak and for a health service environment. So in other words, that they were relevant for our workforce. So that was the main tailoring of it. Also, we included post-traumatic growth, which came from one of their other programs, because I felt it was important for the nursing context, in context of critical incidents. But we did that collaboratively with nurses to tailor those exercises and things and tailor the structure of the program, because it had originally been 6 modules over 6 weeks, and that wasn't going to work for our workforce. So we put 3 modules into each of the workshop days so that they could be released from shifts to do them in one day at a time.
Right. And I guess moving on from that, you were successful in obtaining some funding from the Australian Research Council through a linkage grant where you evaluated the program. So can you talk to us about the PRIN trial that you then ran?
Yes, well, that was an exercise in resilience itself, the trial, because it started in 2020 as COVID started and lockdown started, and we were in Melbourne. So, of course, we were the most locked down. But basically, we had done a pilot at Northwestern Mental Health, which was the trial site, which had promising results. And so we decided we want to establish the effectiveness of the program versus nurses who hadn't had any intervention. So we got the ARC grant, and we did it in partnership with 2 unions, so the Australian Nursing Midwifery Federation and with the Health and Community Services Union and with Safer Care Victoria, who's the Department of Health. So we had a lot of partners on board with it. And basically we did a randomised controlled trial in the health service where staff were invited into the study. And once they completed their initial survey, they then were randomised to either the program group or a control group where they just went about their work as usual. And so we collected surveys over 3 time points. So when they came in, after the program was completed, and 3 months following. And then at the end of the trial, we offered the program to the nurses in the control group so that they got it eventually. They just didn't get it at the time. So that was quite a challenging venture, but we did manage to complete the trial during COVID, which is a huge testament to the commitment of the health service and the staff there. They were very keen to complete the program.
Yeah, I guess that really speaks to the hard work and engagement that you did in tailoring and devising the intervention as well. And that would have been a really important key issue about getting them involved, right?
Yeah, absolutely. It was very collaborative because it had to be, for it to work, it needed to meet the needs of that group.
Yeah, absolutely. And I guess now that the trial's finished, we're interested in learning what you actually found. Did you have any significant findings from the work?
Well, we did, and it's always nail-biting time because you never know with these things whether it is going to be significant or not. But we measured against the program aims. So our primary outcome was coping self-efficacy. So that's people's belief in their ability to cope with challenges. And that was significant. So we did get a significant outcome in the program group versus the control. And we also measured a number of other outcomes. So we measured psychological distress, well-being, psychological well-being, post-traumatic growth, emotional intelligence behaviours, turnover intention, and workplace sense of belonging, because those were all related to aspects that the program was focusing on. And we also found significant results in reduction of psychological distress in the program group. So that was a really big finding, significantly reduced their mental distress, and also improvements in wellbeing, in resilience, and in post-traumatic growth. So those were really important findings. We were really pleased about that. And the other thing we did, which was also important, was we did a process evaluation. So as a second parallel study where we examined the satisfaction of nurses with the program. We interviewed them following the program, about their experience and the skills they'd learned. And we also did a survey with managers in the organisation about how to implement the program, the barriers and facilitators to that. So there was quite a lot of information that we got out of all of that.
Yeah, it's great to combine those both qualitative and quantitative elements within the one.
Yeah.
And it's important also to explaining some of the key findings, I guess. In terms of, I guess, next steps, what are the key recommendations that you're going to be making for as a result of this study? And what do you think might be some implications for other areas of nursing? Because obviously the unique context for mental health nursing, it's very different to other areas of nursing and midwifery, actually. But there might be some things that we can generalise or think about for the rest of our workforce, the nursing and midwifery workforce. So interested in your comments there.
Look, I think we only tailored the program, as I said, for the exercises and activities, etc., and the structure of it for our particular workforce. But it is called Promoting Resilience in Nurses. And so the intention was always that it was relevant to the wider nursing workforce as well, with some adaptation of some of those activities, etc. And our recommendation is that it is relevant for the wider nursing workforce as well as mental health workforce. And we are recommending that it is rolled out more widely, for example, here in Victoria, but also other workforces such as mental health, allied health in mental health and midwifery. There's no reason this program couldn't be adapted for those workforces as well. Because really, to find that a program like this significantly reduced psychological distress, so in other words, improved nurses' well-being and mental health compared to people who hadn't had it, is a really important finding, because nursing work can be very stressful. And we know that a lot of nurses can experience mental health issues as a result of the stress. So it is really important that this program and other similar wellbeing resilience strategies are offered widely to all nursing workforces and across allied health, to be honest. And the other thing that we have found in our other research, and certainly came up in this study as well, is that new graduates and students coming out from universities can struggle quite a lot with the workplace and the shock really of coming into the system, and would really benefit from getting these sort of prevention strategies early in their careers. But we've also had feedback that a lot of clinical leaders, so associate nurse unit managers, clinical nurse consultants, clinical nurse specialists, etc., also would appreciate getting a program like this to help them in their roles. And also more senior staff. We often leave out more senior staff and managers who would also asked for it and also would benefit from it. So really it's the entire workforce that we're recommending it's rolled out to, but in particular those groups. So new nurses coming into the field and graduates, the clinical leaders, the emerging clinical leaders in the workforce, but also managers and leaders who are not currently getting some of those supports.
Yeah, the potential for really widespread health services impact is significant. I can see that, Kim. Thank you so much for sharing so generously all of the experiences and outcomes of your work. You're set to make a big impact for the mental health nursing workforce in the shorter term, but in the longer term, really, that impact can really speak to our students, our new leaders and nurses and midwives who've been working for a long time in the health system. So thank you so much, and happy International Nurses Day.